My name is Phumzile Mlambo-Ngcuka. I'm the Undersecretary General of the United Nations and the Executive Director of UN Women. Access to reproductive health and having the right to decide about one's body for women is one of the biggest issues of independence of women. In many cases, women have children that they have not planned to have. That leads into them not affording to look after the children. Then sometimes they depend on relationships with the fathers of the children only because this person can provide food on the table. In some cases, these are relationships that are not healthy for the women. Women endure violence, and in many cases, it also means that women cannot go out and work or cannot go out and further their education. It's even worse if the women are very young. That is when we have infant mortalities, because these young bodies are not ready to have children. They get sick and sometimes they even die. The chances are that children that are born of women who are not ready to have children will grow up to be poor children. That restarts again the next generation of poor people. One of the most basic but very important goals for every country at a national level to implement, also in compliance with the new Sustainable Development Goals, is comprehensive sexuality education, because many of the girls get into trouble because of access to reliable and decent information. And that information has to be free, and it has to be provided and integrated in schools and in the public health messages that governments and countries provide. Secondly, governments have to make sure that there's funding that is designated for this purpose. And this funding has to be part of the integrated national health plan. Sometimes when we make this an aside issue to fund, government tend to allocate very little money that does not go far enough to service the needs that need to be serviced. Then another important thing is to investing in community education, so that you've got midwives, public health providers who are understood, who are living within and amongst the community, so that they are the go for people within communities who can help at a primary health care level to educate the public and to go to schools to educate the young girls. And in that way, we are addressing this issue at a prevention level, but at the same time, we need to be ready also to address the issue as maternal health issue and as part and parcel of providing some of the curative services.